Welcome back to the deep dive.
It's great to be here.
So our mission, as always, is to take your sources, the research, the articles, the clinical notes, and just extract the vital knowledge.
Giving you a fast track to being well-informed.
Exactly. And today, we're diving into a skin condition that is, it's just notoriously frustrating. It's chronic, and it's almost always triggered by something completely innocent in your daily routine.
We're talking about periorificial dermatitis.
So POD for short. This deep dive is really designed to bring total clarity to this mysterious rash. We want to arm you with the ability to identify what POD is, distinguish it from, common acne or rosacea, and then zero in on those surprising triggers.
It's a very common presentation in dermatology offices, but often completely misunderstood by the patient.
Right.
Periorificial dermatitis is a chronic inflammatory condition. It primarily affects what we call the periorificial region. That's the skin around the openings of the face.
So the mouth, the nose.
The mouth, the nose, and sometimes even the eyes. And we see it most frequently in women, typically between the ages of 20 and 45.
And our sources make it really clear that, while it looks like acne, it's not.
Right.
And it might look a bit like rosacea, but it isn't that either. The visual clues are definitive, and they're the immediate roadmap to the only treatment strategy that really works.
That's true.
So let's start right there. If you're looking in the mirror, you're seeing redness and bumps, how do you know if you are dealing with podony versus, say, just general irritation or a hormonal breakout?
Okay, so what does it look like?
What is that visual signature?
We call the clinical presentation a papulopustular eruption.
Okay, let's break that down.
Right. So in plain English, it means you're seeing clusters of red inflamed patches. And on those patches are small raised bumps. We call those papules.
Little bumps?
And sometimes tiny pustules, which are those visible pus-filled spots. The skin around it is generally dry, sometimes a bit flaky, and people often say it feels really tight or hot.
Okay, but lots of things can cause red bumps. What's the real giveaway here?
The truly critical diagnostic clue, the thing that immediately differentiates POD, is the clear, unaffected border right next to the lips. The rash develops all around the mouth and chin, but it consistently spares a narrow ring of skin immediately next to the vermilion border of the lips.
That is absolutely the key piece of information you need to remember. If you have a rash everywhere except for a perfect clean ring right next to your lips, that is a huge pointer toward POD.
It's the hallmark feature.
So does this condition just look bad, or does it, feel bad too?
Oh, it definitely feels uncomfortable. It might not have that intense, maddening itchiness we associate with, say, severe eczema.
Right.
But POD commonly brings a burning or a stinging sensation. Patients often describe it as feeling hot, sometimes painful, and this sensation is easily provoked.
What do you mean by provoked?
It'll get worse immediately with temperature extremes, like going from a warm room out into the cold wind, or even just by applying common skincare products.
That stinging sensation is crucial. So let's connect the dots. How do we differentiate this from its most common lookalikes, like eczema or seborrheic dermatitis?
Well, if you look at atopic dermatitis or eczema, that's usually more widespread on the face. It's characterized by dryness, cracking, and just severe, almost unbearable itching.
That deep itch.
Yes. POD, on the other hand, is highly localized to that mouth and nose area. It has those pimple-like bumps, and it's generally less itchy, but more prone to burning.
Okay, and what about seborrheic dermatitis? Because that can also show up around the nose.
That's an important comparison because they can overlap. But seborrheic dermatitis has a unique texture. You're looking for flaky, yellowish, sort of greasy scale.
Greasy, that's the key word.
Yes, and it's linked to an overgrowth of a yeast called Malassezia in oily areas. POD doesn't have that greasy scale. It's just inflammation and bumps triggered by irritants.
So if we connect this to the bigger picture, why is getting that diagnosis right so vital?
Because the treatment paths are, they're polar opposites.
Really?
Absolutely. If you mistake POD for seborrheic dermatitis, you might be tempted to treat it with a topical steroid. And as we're about to discuss, that is the #1 cause of POD flares.
Wow. So the wrong treatment makes it infinitely worse.
It's the most common treatment failure we see.
That is the perfect pivot point, because now we have to get to the core truth from the sources, the triggers. The exact mechanism of POD is still a bit unclear, but the factors that kick off this inflammatory cascade are shockingly common.
And here's where it gets really interesting.
The #1 trigger is often an accidental byproduct of trying to treat something else entirely.
That's absolutely right. The single most impactful trigger is the prolonged or inappropriate use of topical corticosteroids.
It's the steroid creams.
Exactly. These are incredibly effective anti-inflammatory creams. You can get them over the counter or by prescription. But when you use them on the thin, sensitive skin of the face, they fundamentally disrupt the skin's structure.
How does that disruption manifest? Is it just thinning the skin?
It's more complex. They do thin the skin, yes, but they also profoundly impair the skin barrier function. They alter the local immune response and change the entire microenvironment of the skin.
And are all steroids the same?
No, and we have to be specific here. The fluorinated steroid variants, the stronger ones, are particularly problematic. People use them for maybe a bit of mild eczema, thinking they're helping, but they're creating a localized dependency.
Which leads to the classic PID trap.
Yeah.
The rebound effect. Can you explain what happens when someone finally realizes the cream is the problem and tries to stop?
The rebound is brutal, and it's why it's so hard for patients to get out of the cycle. When you stop the steroid, the skin has become dependent on it.
Right.
And it reacts with a severe, immediate inflammatory flare, often way worse than the original rash ever was.
So, of course, you go right back to using the cream.
Yeah, you're compelled to. You go right back to the steroid for relief, and that just traps you, making the PID worse and worse over time. It takes real patience and medical supervision to break that cycle.
That's a huge challenge.
Yeah.
Now, let's talk about the microscopic neighbors that are also involved here.
Right. So while the main culprit is that chemical interference, we also see a secondary microbial component. For instance, Dermatitis mites.
Yeah, everyone's favorite topic.
Yes. These are microscopic organisms that live naturally in our hair follicles. But when the skin barrier is damaged by steroids, these mites can multiply excessively.
Triggering more inflammation.
Exactly. And we also sometimes see the involvement of Candida species, which are fungi. They thrive in moist environments like the corners of the mouth, especially if your skin flora is already out of balance.
So chemical disruption from steroids, opportunistic bugs making it worse.
Yeah.
But the sources also highlight triggers that are just completely mundane, things we do every single day.
Yes. The first one that surprises most people is dental hygiene.
Toothpaste.
Fluorinated toothpaste. It's a known irritant for the skin around the mouth. The fluoride is great for your teeth, but it can be caustic to damaged facial skin, sparking a flare-up.
So switching to a non-fluoridated option is a key first step.
A simple but absolutely critical first step in prevention.
That's fascinating. Something designed for health causing this inflammation right next door. What about our skincare routines?
Skincare and cosmetics are massive factors. Any product with harsh chemicals, synthetic fragrances, or alcohol-based toners can just further compromise an already weak barrier.
What about moisturizers?
Heavy, thick moisturizers or oil-based foundations can sometimes exacerbate the issue by blocking pores and, potentially feeding that microbial imbalance.
And what's going on inside the body?
We can ignore internal factors. Hormonal fluctuations are strongly implicated. Flares often coincide with menstruation or pregnancy.
And stress, I assume.
Oh, absolutely. Stress, both emotional and physical, is a powerful trigger for inflammation. And conditions like polycystic ovary syndrome, PCOS, are also linked.
And finally, diet and environment. What should you be keeping an eye on there?
The sources mention anything that increases blood flow and warmth to the face. So think spicy foods, high consumption of alcohol.
Even hot coffee.
Even frequent consumption of very hot beverages. They cause temporary vasodilation, the widening of blood vessels, which increases redness and inflammation.
And outside.
Extreme wind, prolonged sun exposure, pollution. It all underscores how fragile that compromised skin barrier really is.
That's a powerful list. It means managing POD is less about a silver bullet prescription and more about a complete overhaul of your daily life.
It really is.
So if you suspect you have this, what does the comprehensive medical treatment look like?
The treatment hinges on one mandatory first step: topical steroid discontinuation.
Non-negotiable.
It's non-negotiable, and it must be done carefully, usually by gradually tapering the steroid under a doctor's guidance, just to make that rebound effect tolerable.
And after that,
Yeah.
what's used to actually calm things down?
Beyond that, we use specific medications. The pillars are antibiotics. For a milder rash, we might use a topical antibiotic like metronidazole applied right to the area.
And for more severe cases?
For more severe cases, we use oral antibiotics, typically from the tetracycline family, like doxycycline or minocycline. And these are used not just for their antibacterial properties, but mainly for their strong anti-inflammatory effects.
I want to focus on the alternatives to steroids for a minute. What role do the topical calcineurin inhibitors play?
They are an excellent alternative, often the preferred choice for sensitive areas like the mouth and eyes, drugs like tacrolimus and pimecrolimus.
How do they work?
They work by inhibiting the immune cells that cause inflammation. So they suppress the immune response locally, like a steroid, but, and this is critical, without the risk of skin thinning or that dangerous rebound effect.
So they let the skin calm down without causing more long-term damage.
Precisely. And of course, we might use antifungal treatments if candida is suspected. For any residual redness that sticks around, laser treatments can also be used.
So what does this all mean for your daily life? The prevention strategy seems just as critical as the medical treatment.
Exactly. It means turning that list of triggers into a checklist of things to avoid.
So switching to non-fluoridated toothpaste, using gentle, fragrance-free soaps.
Absolutely. And rigorously avoiding harsh chemicals or excessive scrubbing. Prevention also means protecting your face from the sun and wind and actively managing stress to keep those internal inflammatory signals quiet.
And that leads us directly into product selection. No cream is going to cure this on its own, but the right skincare can support the healing process.
Right. The goal is gentle, barrier-supportive, non-comedogenic, non-irritating hydration. It's about minimizing recurrence.
Let's dedicate some time to the ingredient list, because this is where you need actionable knowledge. We have examples from the sources mentioning ingredients in barrier creams, like those from Era Organics. Let's unpack the function of fatty alcohols.
Yes. When people see the word alcohol on a label, they panic, thinking it's a harsh irritant.
Like rubbing alcohol.
Exactly. But we need to distinguish between drying alcohols, like ethanol, and fatty alcohols, which are completely different. Fatty alcohols, like cetearyl alcohol, stearyl alcohol, cetyl alcohol, are solid, waxy compounds from natural fats.
And what do?
They are essential emollients. Think of your skin barrier as a brick wall. These fatty alcohols are like the mortar. They lock in hydration and smooth the skin. They are non-irritating and key to helping rebuild that damaged barrier.
And what about the array of natural soothers that often accompany them, like colloidal oatmeal?
They're crucial for managing the symptoms, like the burning and itching. Colloidal oatmeal is a classic anti-itch ingredient. Aloe vera provides deep hydration without being heavy.
And things like manuka honey or shea butter.
They all serve as potent moisturizers and occlusives, providing the lipids and nutrients the skin needs to heal. An anti-itch cream, for instance, would rely on that soothing blend to break the discomfort cycle.
So the big takeaway here.
The takeaway is that periorificial dermatitis is a chronic condition, but it is highly manageable once you stop feeding it the irritants it craves. Your job is twofold. Immediately stop using any topical steroid and then relentlessly scrutinize every single product and habit that touches the perioral area.
And always see a doctor.
Always. Because of that severe rebound risk, you need a healthcare professional to guide you through the process.
That is the essential deep dive into periorificial dermatitis. It's a perfect example of how the solution to a persistent, complex issue often lies hidden in the seemingly innocuous parts of our daily routine.
It really is.
We've focused heavily today on the link between inflammation and our personal care products, from toothpaste to face creams. So here's a final provocative thought for you to consider.
Okay.
Given how sensitive the barrier of our skin is and how easily it can be compromised by fluorides or specific chemicals, what other aspects of your daily routine, perhaps in cleaning products or the air quality you breathe, might be silently eroding your body's natural defenses or contributing to low-level chronic inflammation that you aren't even aware of yet?
That's a great question to think about.
Keep exploring the interconnectedness of your environment, your personal care, and your overall health. We'll see you next time for another deep dive.